The old adage that an ounce of prevention is worth a pound of cure is as relevant today as it was yesterday. Many people are dying of diseases they could have detected and managed through preventive health care.
About 40% of Ghanaians are hypertensive, and most of these people don't know that they are hypertensive.
Currently, there is a global shift from curative health care to preventive health care, which is cheaper and safer. This paradigm shift has been the drive of the German government's Support for the Prevention is Better Than Cure (PBC) project in Ghana since April 2015. The 3-year project, commissioned by the German Federal Ministry for Economic Cooperation and Development under the Develop PPP program, is being executed by GIZ Ghana.
GCNet, die Deutsche Gesellschaft für internationale Zusammenarbeit, is a provider of international cooperation services for sustainable development and international education work.
The PBC project is jointly implemented by GIZ and selected private partners in a strategic alliance defined by their shared desire to reduce disease burden and health bill.
Our core business as Claron is prevention. So when this project came, we felt it's appropriate for us to be like strategic partners. If you look at a lot of the companies around the airport residential, we've done free dental screening for them. And also other big private communities like Mamobi, we've also done free medical screening for them.
Our contribution for this project was the hematology instrument, the XN 1000 that we donate to the project.
One of the key parts of our program has been a breast screening program, which started from really quite a small and basic thing that we wanted to do for our workforce. And in the course of the 3 years under Prevention is Better Than Cure, finished up screening over 10,400 women and girls in the host communities.
The Ghana Health Service is involved in steering the PBC project through the Health Promotion and Occupational and Environmental Health departments. The PBC project is also being implemented in collaboration with the Ghana Association of Quasi-Government Health Institutions, GACI.
But if you go to the Ghana Post one, where they have created a room for the preventive health services separate from the general health facility, where anybody can walk in at any time to check him or herself. We can say that that is an innovation in the healthcare delivery system in Ghana, and that's what actually GACI set out to do.
For the VRA staff, we have arranged for them to come to this facility. So the authority has instituted annual medical exams. So for the whole year, if you don't come here, at least once you pass through here.
We as a university have a health screening program for our staff. So since the PBC started, it came at a good time and it coincided with that time. So it helped us to structure and to envisage well what we needed to do.
In the clinic here, we welcome all staff and dependents and even people that walk in from all walk of life that want to know about their health. When they come into the facility, they walk into the PBC clinic. It's at the clinic that they meet one-on-one with the nurse that is manning the place.
So we do malaria tests, we do hepatitis B tests, we do HIV tests, then we do other tests too. For now, we provide only service to police personnel.
Most of the people who come around here are the KNUST staff and the students, and a few privates. When I say privates, it's basically the communities around KNUST Hospital. We have about 30 communities here that we serve, so most of them are from one of those communities around. We have a breast cancer screening program that we are doing. We have prevention for cardiovascular disease, so blood pressure.
Non-GACI health facilities also participating in the project are the Golden Star Resources Community Clinic at Achempim and Shai Usudoku District Hospital in Dodoa.
My role as a PBC coordinator is to create awareness of the existence of PBC. And I do this through education every morning at the outpatient department in the ANC antenatal clinic. I remember a lady just listened to our health education and she decided to walk in. After she got there, we checked the fasting blood sugar and we realized it was 33.3, very high.
Another important component of the PBC project is community outreach, during which some of the health facilities organize health screening and educational activities in their catchment communities.
I live at Ikuma. I was here when some people came that they are come to make program about prevention is better than cure. So I went and they talk about how you be checking your BP and your sugar distance to help you that the sickness shouldn't come seriously. So I went. When I went, I know that I'm having BP. So instruction that they gave me, I started treating it.
One unique aspect of the project is a health insurance component provided by Glyco Healthcare and Nationwide Mutual Health Insurance.
Our role in the project mainly is to educate our own employees about prevention being better than cure, and then also to introduce preventive packages into the healthcare insurance policies we are holding.
We're supposed to integrate the preventive healthcare services into our health insurance plan. So we've added that to at least some basic health tests like full blood count, blood pressure, HIV, hepatitis B. We included that in our health plan.
Another vital component of the PBC project is the development of a software application by GCNet to help both service providers and beneficiaries of the projects track relevant data on their clients and health status.
Already we were doing screening using paper. So what we did was we captured the data on the document. What that information does is it helps the risk engine to be able to predict or tell the patient whether he or she is at risk.
It's helping us also to make sure that we keep our health statistics in check. That will help us a lot because, for health planning, you can't do without health statistics.
Dr. Colin Saholu of the Noguchi Memorial Institute for Medical Research is a public health consultant assigned to document project-related experiences.
It's a good project. Especially it has created awareness in everywhere we went. There's awareness that there is a need to seek for preventive health services.
The target set was 3,500 staff and employees of the STA companies being beneficiaries of the service. We have long gone past the 3,500.
Inspired by the remarkable success of the PBC project, strategic alliance partners are eager to sustain it even after the project closure in March 2018.
We now really understand the value of partnerships and what we can do to try and sustain the prevention is better than cure concept in our host communities.
Even if the project ends, Glyco Healthcare will continue to render preventive health services to their clients and their staff.
We are hoping it will become a way of life for them. Because it's part of the policy, they will do it annually.
We've seen significant changes in people's reaction to their health care when it comes to healthcare and their way of living. I'm sure that it will move like any other unit that is already established in the hospital.
Pushing harder this agenda of preventive medicine would, in the long run, even reduce government budgets to the health sector.
This project naturally has its way of being sustained, and we do not expect that the PBC units that have been set up would be closed down for any reason.
It's a challenging and a very good experience to be present here in Ghana as GCNet and to work in a respectful way with the Ghanaian partners.
Let's all resolve to give true meaning to the adage, prevention is better than cure.